The high cost of medical care is giving some Americans sticker shock. Annual health care spending in the U.S. is estimated to be $3.5 trillion. Hospital costs make up almost a third of that total. Kaiser Health News, in partnership with National Public Radio, uncovers inconsistencies in its Bill of the Month series.
And this month, that series takes a look at Drew Calver. He was hospitalized last year in Austin, Texas for a heart attack and needed 4 stents in his arteries. He has health insurance through his teaching job, and the insurance covered $55,000 of the bill. But a month after treatment, he and his wife, Erin, got a bill for nearly $109,000.
Early May, I got the first bill. It's like, all right, that's not right. 2 weeks later, I get another bill, and this routine that just got exhausting. Every 2 weeks, I'm getting my folder out, looking up the numbers, got my little notebook.
He would call, and then it would just stress him out, and then we're getting, bills in the mail, and it's not adding up to us, and we're just confused and we're frustrated.
Out of supplies.
I want to have dinner.
My focus should be staying healthy and preventing another heart attack.
You do all this to save this person's lives, and then you're making their lives like a living nightmare.
Exactly, is what a lot of people say about that. Kaiser Health News and CBS News contacted the hospital. It's St. David's Medical Center. So they told Calver that he may qualify for a financial assistance discount, which could bring his bill down to an estimated, listen to this, $782. The hospital says that it offered Calver the opportunity to apply for financial assistance several times, and that the charges reflect the retail price for a procedure, treatment, or visit. Dr. Elisabeth Rosenthal is editor-in-chief of Kaiser Health News and joins us at the table really to sort this out, because it sounds like they got some splaining to do. So he gets a bill of $109,000, and it can be negotiated down to $700-something. How is that even possible?
Well, the prices that hospitals charge are kind of arbitrary. They can be anything.
They pull it out of where, Elizabeth? Where do they get it from?
Thin air. I have to say, I looked at this bill, and the prices for everything, every line item, were just exorbitant. $200 for a blood test, $20,000 for one single stent. I mean, who knows? We looked into that. Those stents probably cost $1,000. So there's markup on everything.
But who knew you could negotiate? I'm used to saying, is this the best price? I didn't know you could do that with your hospital bill.
Well, this is my first piece of advice to people. Don't write the check. That you have some agency, you have some power. So the first thing is you get the itemized bill, because who would pay for anything that you didn't, when you didn't know even what you were paying for? Then go in, you can negotiate, and here are some tools you can use. You can look on Healthcare Blue Book. You can look at what Medicare pays, and you can go in and say to someone who's trying to charge you $100,000, this is ridiculous. This is way above the norm. And the funny thing is, hospitals expect this and sometimes will respond.
I don't understand why his insurance didn't cover it.
Well, this is the odd thing. We're talking about a $100,000 plus bill after insurance. His insurance paid the hospital $55,000 already. So what we have here, which is a really common situation in American medicine, is the hospital and the insurer disagree on a price, and the patient gets left holding the bag for the difference.
But to clarify, the hospital was an out-of-network provider, but they told him they would cover it because it was an emergency. Don't these deductibles in your health insurance too, once you meet a certain deductible, don't they cover above and beyond that?
No, he got caught in a trap. There's this, as you said, there's out-of-network care, but in an emergency, any hospital, whether it's out-of-network or not, has to give you care. But what happens when it's out-of-network is your normal insurance protections don't apply. So that's called surprise billing. That gap that they can go after you for is a surprise bill. Now, many states, 21 states now have surprise billing laws that mean to, in part, hold the patient harmless in the case of something like this. But they don't work very well, as Drew found out. His insurer paid $55,000, and then he was hit with a $110,000 bill. It's really outrageous.
So is this an acute case that's special with special facts, or could this happen to anybody based on what you just described?
This could happen to anybody, and we get literally thousands of bills. So this does happen to everybody. it may not be at $100,000. You know, this is kind of an extreme amount of money, but in smaller amounts, $10,000, $20,000, it happens all the time.
Well, just the fact that you call it Bill of the Month series says to me that there's an issue here. I'm just stunned to know that we can negotiate that way.
Yeah.
You can negotiate.
That's good to know.
And you should know you can negotiate. You should check what the laws are in your state with your health plan to find out what protections you have. And you should always, always, always fight back. I think that's the message. That
Fight back.
Don't just write the check.
While you're simultaneously trying to fight back against whatever the illness
Well,
is.
that's the real sickness, right? That
Yeah.
when
Good
you
advice.
should be focusing on your heart attack and recovery, you're instead stressed out about your credit rating.
And not
Yeah,
for nothing,
good
those
advice.
bills are hard to read, too.
Thank you,
That's
Dr.
also a problem.
Yeah, I
It's hard to read.
Yeah.
Dr. Elisabeth Rosenthal, thank you so much.
Thank